These are really challenging times for our community. And what people want right now is they want information. They want to know really what's going on. And they want to know it from the people who know the most.
Doug McMillan, CEO of Cody Regional Health, says they're taking extra measures with regards to COVID-19 preparedness.
The hospital, Cody Regional Health, took initial steps, actually at the beginning of last week, to put together our incident command control structure. For situations like this. They did a great job, actually put it together several days before this was declared a national emergency in our country. So with that, with our incident command control structure, ICS, we've partnered with the Billings Clinic. We're partnering with the Northern Wyoming Surgery Center, as well as other entities, public health, and now working with the Emergency Operations Center.
Dr. Adam Peters is a family physician at Billings Clinic in Cody. He says that from a medical perspective, they're consolidating their efforts to screen people effectively. That means that at Billings Clinic, West Park Hospital, and the Cathcart Center, they're trying to steer people who may have symptoms of the virus to one location.
What we're trying to do is to set up what's called a viral screening unit. This is going to take place at so the ER is on one end of the hospital. We have an old cafeteria that wasn't being used for anything at the other end of the hospital. It's away from all the patient care, and we are putting that viral screening unit there where we can consolidate our efforts and make it safer for everyone.
McMillan echoes the need for screening and explains the other measures taken by the hospital, including limiting some services.
So a lot of things have been put into place this week. Number one, starting with screening. We're screening every individual that comes in the organization, all hospital employees, physicians, and every community member, which is very important right now in our community. Also, we're limiting visitors. So with that, we are limiting visitors to all areas of the organization, again, in an effort to protect our patients and everyone that comes in our organization. We've also done a few other things. With that, we've eliminated a lot of services. So this week, we stopped doing elective surgical cases, and we've also stopped doing most ancillary services, clinical services that are not emergent. Such as imaging. We're no longer doing elective imaging services, cardiac rehab, wound care. We will be moving wound care out of our organization. Cedar Mountain Center, we are clearing our Cedar Mountain Center wing, and rehab. So there's some of those services, there's some examples. So with that, our organization and staff is doing a tremendous job. I'm very proud of them.
However, Dr. Peters points out that there aren't very many people locally who have shown symptoms of COVID-19.
You know, COVID, the same symptoms are mimicked by RSV, by influenza, by multiple different types of viruses that cause the common cold. It's very difficult to differentiate those who have COVID from those who don't. And that's the real problem, is that we don't have the testing available to make that differentiation. In the end, and kind of how it's developing, is what we're seeing the tip of the iceberg. We're seeing the sickest patients, those sickest patients get tested, and then we can tell whether or not they're positive for COVID or not. And usually what we're finding, to be honest with you, is those who exhibit these classic symptoms for COVID, they end up having influenza or RSV or something like that. We're just not seeing, we don't see this huge influx yet. They say it's coming, they say it's a surge is coming, and we've seen that happen in Italy. We're seeing it happen in the East Coast. We saw it happen in Washington, and so we're trying not to be alarmist, but we're trying to be prepared. In the end, if this all passes over and everything was good and we never had any deaths and didn't have anyone on ventilators, that's a success. We were prepared. But if it does come our way, we're doing everything we can to make sure that we're prepared to take care of these folks.
McMillan noted that the hospital is responding to the many questions that the community has by offering an additional service.
I know what I hear as CEO is around the community from our partners and people that are anxious is information. Where can people get information? One of the things that we just started, actually opened today, was the call center. So we now have a call center, and we did over the last couple days, but we've expanded it and we've made it easier for our community. So individuals can now call our call center, which is 578-2000. We're staffing the call center with 2 nurses, 12-hour shifts, so I think it's 7 a.m., 7 p.m. So we have nurses available that can address individuals' questions and direct them where they need to go. Either stay home, continue to quarantine themselves, or else refer them to, as Dr. Peters addressed, our viral screening area, or if it's severe, to our emergency room.
Dr. Peters took this opportunity to explain in a little more detail what happens if you do come down with symptoms.
If someone has a low-grade fever, cough, cold, isn't feeling so bad, we really recommend that they stay home. Don't come in, don't be seen. If you can manage it at home, just stay there. That's the best thing to do. Again, we're trying not to get other people sick. If you get bad, you would come into this viral screening unit, which should be up and running by tomorrow. And at that point, what we do is we make sure that you're sick, and then we rule out the common stuff. We rule out RSV, influenza A and B, and then we have a viral screening panel that we can run, which are some of the other less well-known viruses that can cause illnesses. Once we rule those out, and if you're sick enough, that is when you get screened for the COVID-19. And again, as Doug alluded to, we don't have a ton of those tests, so we kind of have to limit them. And because we don't have a ton, we'll test you for other things first. If you're positive for that, then we'll come back and test for the make sure. If you're positive, then we say, hey, you got that. Likelihood is that you don't have COVID-19.
In an example of the generosity of the community, McMillan confirmed that a generous donor has offered to purchase additional medical equipment if needed.
Well, I don't know who it is, but through Incident Command, we have a donor that's come forth to express an interest in purchasing additional ventilators for the organization.
Dr. Peters pointed out that while they're following the recommendations of the Wyoming Department of Health and local public health officials, he praised community leaders and the Cody medical organizations for staying ahead of the curve when it comes to preparedness.
I would have to say that we, as Cody Regional Health, were a little bit advanced. We closed off the elective surgeries sooner than others within the state. We called the Incident Command a little bit earlier. I think we're doing a great job. We're really trying to be prepared, trying to be ahead of the curve rather than behind the curve. And I think our staff, just like Doug was saying, our staff is doing a very good job. They're working their tails off.
McMillan assures residents that they are well prepared at the hospital with cleaning supplies and other materials they may need to maintain the safety and security of their facilities.
Again, it's very important when you talk about logistics, which is part of the Incident Command structure, ensuring you have the proper resources in place, which again, our organization, our materials director, Jeff Sandvik, has done a great job ensuring we always have the inventory in place to take care of our staff, which includes cleaning supplies. And then more importantly, when we get into situations like this where we have had to initiate our ICS structure, just being able to work with the state and again the government in securing the supplies and PPE, all the supplies we need to protect our staff and take care of our patients. And we've done a great job. It doesn't mean we're comfortable. Again, with that, when I say comfortable, it depends on the surge that Dr. Peters refers to. But again, our staff's done a great job ensuring we have all the PPE and supplies in place to provide great care to those we're serving.
Dr. Peters says that although they can't predict what will happen next, the important thing is to be prepared.
Again, this is all about preparedness, and if we only had a crystal ball, that would be great. But what we're prepared for and what the authorities have said is coming is this surge, and that is where you have a certain number of people who have the illness, and it all of a sudden climbs. And it climbs because I'm getting sick, then I get 2 people sick, and then those 2 people get 2 people, and it just kind of blossoms out that way. And those are the measures. That's why they're saying don't go to school, don't do anything, don't go to restaurants, etc. So we're preparing for this surge, And again, most people who get the virus are going to be asymptomatic, but there will be those minority who really get sick with it. And that's what we're trying to prepare for, is those people who really get sick will need care, and we have to take care of them. We need to take care of them. We need to be prepared. And so that's really what we're trying to do.
Addressing one of the most acute concerns of residents, both Doug McMillan and Dr. Peters acknowledged that the first confirmed case of COVID-19 was an employee at Cody Regional Health. Dr. Peters outlined what happens now with regards to follow-up from that first case.
So we have an infectious disease specialist working with the hospital by the name of Kyle Paquin, I believe, and he has been following everyone who had contact with this individual and has been monitoring them on a daily basis. They take their temperatures a couple of times per day and make sure that they don't have symptoms. Anyone who does have symptoms, it's an immediate 14-day, they have to go home and isolate themselves. And so they're doing a great job of monitoring for anyone who had any contact, incidental, whatever it may be.
But as a self-proclaimed optimist, Dr. Peters had a word of advice for everyone who's been unsettled by current events.
Just hang in there. And remember, this is a great time to spend with your families. Play some board games, watch some movies together, just love each other, make some food together, you know. Try your best to stay out of those places where there's a lot of individuals. Maybe, you know, change the time you go to Walmart for the food that you need, but enjoy this kind of unprecedented time in a different way. Make sure that you take time to smile and be happy and to say a joke or two. We'll get through this. We'll get through this as a nation. We'll get through this as a community.
Once again, that COVID-19 call center staffed with 2 RNs between 7 a.m. and 7 p.m. 7 days a week. That phone number is 307-578-2000. Please feel free to call that number if you have any questions. Thank you all so much. Folks, we're going to get through this. We're going to be stronger as a community.